Hello, welcome to the latest episode of the Health Wrap by the Hindu. This week, we bring you stories on the quiet aftershocks of COVID-19 on the heart, men's health, and what global moves on essential medicines could mean for India. So, Zubeda, as we start this week's Health Wrap, let's look at the whole COVID-19 situation. I mean, the virus is past, the so-called pandemic is past, and the world has opened up. But we are still talking about how COVID-19 has impacted human health. We published studies this week showing how the virus has affected vascular aging. When we say vascular aging, we mean the age of the blood vessels that carry blood inside our body. And what does this mean? In practical terms, it means an increased risk of heart attacks, strokes, and hypertension or high blood pressure. This is quite serious, actually.
Yes, it is, isn't it? Especially because, as we reported, the study showed that women were more severely affected than men when it came to vascular stiffness. The stiffening or the narrowing of the arteries was more pronounced in them. And as you said, this leads to an increased risk of multiple cardiovascular issues. And it's so strange that even 5 years after the pandemic first began, we are even now discovering how it has impacted our bodies long after we thought that we were better.
That's that's a fact of life, I guess. But why this is critical for us is because we are a country with a huge burden of diabetes and hypertension, and therefore risks of cardiovascular disease and stroke. So screening becomes very important, and particularly those with COVID and over 40 years, I think, is essential to get an annual health checkup in order to test cardiovascular health. And once detected early, we all know that prevention is easy. You can, put off the complications, and you can lead a fairly healthy life with certain lifestyle modifications. So I think, regular cardiovascular checks are important for anyone recovering from the virus.
Yes, absolutely. Regular screening is so important. And as you were saying, the burden is high. And another Lancet report, which we also reported upon, has found that the burden of chronic diseases, as we all know, is extremely high in India. And even in India, again, women seem to be disproportionately affected. And that is something I think we should begin to take very seriously.
Absolutely. And we've said this many times before, but it is, it should be repeated as many times as is possible, that the key is to adopt a proactive approach to healthcare. We can say preventive, but we're not actually talking about disease onset yet. We're talking about starting young, starting early, and making sure that one has a healthy lifestyle, eating well, eating good food with a lot of fiber and protein, making sure that people get exercise, and trying tactics, whichever works for you, to alleviate the stress that one feels as a part of daily living these days.
Absolutely. And nobody emphasizes enough that this has to start at school age. You can't just randomly begin it from your 30s or your 40s, but you have to ensure that this is a lifestyle that is adopted from the time you're in your teens and in your 20s, even though you may feel very healthy at that point in time, even though you may feel that exercise is not required, or you might feel that you can eat anything you want. The idea is to begin as quickly as possible.
Absolutely. We did this book on healthy aging, remember? So Shades of Grey, which is available on our website. So remember, in that we spoke about cognitive aging, and that is of course to do with the mind. But in that we spoke about how it is important very early on in life to inculcate this proactive healthy lifestyles. Making these conscious health choices from an early stage, make sure that you can, live your life the way you wish for a really long while and doing the things that you want to do. So I think that is very important today, and we can't emphasize that enough. This week are not, too often spoken about, and they are to do with men's health.
Absolutely. Men's reproductive health seems to be an issue that is there in our country, but is still not spoken about often enough, not amongst patients and not amongst everybody else in society either. And one of the experts who wrote in for us this week talked about peyronie's disease, a condition that many men hesitate to talk about because it has to do with the reproductive organs and affects sexual functioning. And this disease, he says that many men might have it, but might not want to come forward in order to get a diagnosis or treatment, and that the stigma around this needs to be broken.
These cause difficulties while, performing sexual functions. And that might be part of the stigma surrounding the disease. But the sad thing is that there is, and there are, in fact, several treatments that are available that will help cure the condition, alleviate the pain, take away the suffering, and make you comfortable, doing what you do. This is from medicines to procedures that can be done on the individual. And it's important, once again, to come to the doctor early and not push it until the last.
Absolutely. Normalizing conversations around this has to become part of what we do.
So staying on with the topic of men's health, the other thing that we wrote about this week was about testicular torsion. Of course, it affects men as well, but we were looking at it from the point of view of how it can affect the life of a child. Testicular torsion is a condition where the testicle twists around the spermatic cord, cutting off blood supply to it, and it can have serious implications in the future for the child itself. So doctors are saying that this can be resolved as well, but the need again and again is to bring the patient to the doctor immediately and start treatment as soon as possible.
Yes, the doctors have said that within a matter of hours, your child should be seen by a physician in order to be able to preserve testicular function. And one of the problems is that children are often not able to express themselves very well. They don't know what is going on. They don't know how to say what is going on. And so it is upon parents to be aware of what these symptoms for this look like, especially parents of boy children, and to be able to address it immediately by taking them to a doctor.
Yeah, so initially this will cause pain and swelling. So if the child does complain, I think it's incumbent upon the parent to immediately address it and not treat it like a boy's joke or someone is kidding or, playing the fool. So again, awareness among parents, like you said, is very important to bring the child as soon as possible to the hospital.
Yes, doctors say any sort of pain in the reproductive organs should be treated as an emergency anyway.
The other development, crucial one this past weeks, is the WHO putting on its updated essential medicines list class of drugs that are called GLP-1 receptor antagonists. We might know them more commonly as semaglutide and tirzepatide. They are available as pills as well as injection for patients. It is basically used to treat diabetes and additionally obesity. In recent years, it's being used only to treat obesity and, people take to it as if it's a over-the-counter drug, but it is not. But the point here is that this particular move by the WHO will improve access to a large number of people in this country who require the drug.
Yes, Ramya, as you were saying, this drug is not an over-the-counter medication. It is used to treat serious conditions such as diabetes and obesity, and that is especially crucial for India, which has a massive burden of diabetes and a growing burden of obesity. And as you said, this might spur governments to also be able to make access to this medication a little more affordable and a little more equivalent to other people.
It's proven that in the past, the WHO putting medicines on its list, EML list, has led to the reduction in prices and in better access to these drugs. In countries like India, where access to drugs is very expensive, people spend out of the pocket for their drugs, it is important for the government or the state to make these drugs easily available. Semaglutide is also going off patent soon. So hopefully that will reduce the prices even further and make it better accessible to the people who require it. Not for all, but for those who require it. And I think the WHO's move is wonderful coming at this point of time. And it will have to be dependent on governments how they take this forward.
Is it time for a fun fact now?
Oh, absolutely. We were speaking about COVID when we started. And so maybe, we should sort of sign off with COVID again. It was recently reported that the COVID virus remained in a man for 2 years. Like, it was not long COVID, but the virus stayed inside of an individual who had HIV and therefore his immune system was pretty weak. Inside of him, it mutated nearly as many times as it mutated in the world outside.
Wow, that is fascinating to see how the virus can behave.
Maybe that's why we are in health, because it gives us such fascinating pieces of information regularly. Thank you for watching the Health Trap this week. Do remember, for these stories and more, click on the QR code to the left of me and it will take you directly to the health page of The Hindu.